right. One of the questions that I many times get is, well, what can I do to prevent or control my bleeding gums, what are called gingivitis or periodontal disease? And so the standard thing is always, well, brush, 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 with an emphasis particularly down along the gum line. Number two is typically using dental floss and getting it in between the teeth and using a wrap technique, kind of almost like a C form or a U shape, and rubbing up and down those root surfaces. For those individuals, many people have a lot of difficulty maneuvering their fingers, particularly to get at the back teeth with dental floss. And the thing that I really love is a water pick device, basically like almost a pressure washing of the teeth with emphasis on the cleansing between the teeth, those hard to get at areas. You try to get in there with the floss, but many times there's still debris in there. So a water pick is going to flush that debris out of those areas. Let's say, for instance, that you're brushing, you're flossing, you're using the water pick and stuff, and your dentist is still saying, geez, you still have these areas of redness, of irritation, and areas that tend to bleed. Well, what can you do? Is it just brush more, floss more, water pick more? There's another option out there, and it involves, it's called PerioProtect. And what it involves is making a custom-fit plastic carrier that hugs the teeth and the gums. And into that carrier, we put a slow-release, low-concentration hydrogen peroxide gel. And the tray is made in a fashion such that when you put that tray in your mouth, there's a hydraulic pressure, a hydraulic force that is created that forces that hydrogen peroxide gel down around the gum line and under the gum. And the peroxide is going to go after the bad bugs, the bugs that are primarily responsible for creating that irritation and promoting the periodontal disease. So the beauty of the PerioProtect is you do it in the privacy of your home. The trays can be plugged in for 15 minutes. You can do it, I do mine in the morning. When you're taking a shower, the trays go in. By the time you're done showering and shaving and such, and getting dressed, the 15 minutes has easily elapsed. And at night, you're sitting in bed, maybe doing a little reading. I've got the trays in there. Read for 15 or 20 minutes, take out the trays, and you're good to go. The people that I have seen, I've treated a tremendous number of people using this methodology, and the people will come back in and they'll say, Doc, this is awesome. I don't notice a bit of bleeding. My gums feel healthier. And another side note to this, they said, I have fresher breath. Is fresher breath, part of the package here? And the answer is absolutely, because the bacteria that promote the stinky kind of the raw egg, rotten egg, or poopy kind of smell are the bacteria that this peroxide are going after. So, and there's one other thing, there will be a gradual whitening effect to your teeth when you're using this methodology. The peroxide is going to cause a whitening of the teeth. So there's a number of things that are very positive about it, and I'm really excited going forward about what this potentially can do to help a lot of people out there that have gum issues or are headed for significant gum issues. As our society, we're living older, longer. People want to eat, and the best way to eat is to have your own teeth. Dentures and the like just don't quite cut it if you want to eat peanuts, popcorn, peanut brittle. Let's say you want to eat a salad and you want cucumbers on that salad. You want to eat nuts, almonds, and things of that sort. You're not going to do that if you don't have your natural teeth. So anyhow, anybody that has further questions on the subject matter, we would be more than happy to entertain your questions. So thank you.